Let's start the session. Let's talk about something which is really, really important. So this session is going to be about chronic kidney conditions, chronic kidney disease. Now, this is a really, really troublesome problem. It not just affects the patient, it affects the entire family. It does not only have a burden on your health, on your mental status, on your physical status, on your performance. It not only affects you as an individual, it definitely affects massively the rest of the family as well. Now, this is a very, very difficult thing to tackle. But unfortunately, having progressed in so many fields, in so many ways, still we are stuck in the way we handle chronic kidney disease for many decades now. Thankfully, in the last few years, there have been new and recent advancement towards how we understand kidney functions and the role in conjunction our digestive system also plays. Naturally, gut kidney axis is something which has been raising its head and trying to get itself noticed. बहुत ही इंपॉर्टेंट है ये गट किडनी एक्सिस के बारे में समझना उन लोगों के लिए जिनको किडनी की वजह से बहुत सारी प्रॉब्लम्स बहुत समय से चल रही हैं या अभी ही क्रॉनिक किडनी डिजीज उनको अफेक्ट भी करी हो तो भी ये इसलिए जरूरी है क्योंकि किडनी हालांकि बहुत सारे इंपॉर्टेंट रोल प्ले करता है लेकिन उसमें से बहुत सारे काम आप रिकवर नहीं कर सकते किडनी को पूरी तरह से ये बात सारे क्रॉनिक किडनी डिजीज के पेशेंट्स को पता है you know that you cannot fully recover from a kidney which has gone into some kind of a, let's say some a large part of kidney in your case has died so you cannot revive it. Yes, that cannot happen, but the work that kidney is supposed to do, can it be distributed? The answer in the recent times and recent research is yes. So today we are here accompanied with Dr. Sandeep, who is a consulting nephrologist with 12 plus years of experience. There is a common narrative कि chronic kidney disease को किस तरीके से ट्रीट करना चाहिए, किन पैरामीटर्स को ध्यान पे रखना चाहिए और किस तरह से काम करके किस तरह को पेशेंट को हम ज्यादा से ज्यादा कंफर्ट दे सकते हैं. बट एक ऑल्टरनेटिव नैरेटिव भी है जो बहुत इंपॉर्टेंट है. क्या कोई इंटीग्रेटिव तरीका है? क्या मेन स्ट्रीम इसको सपोर्ट करती है? क्या इसके पीछे कुछ साइंटिफिक एविडेंस है? So many of these questions are there, and thankfully we have Dr. Sandeep, who has been working in this space for many, many years. So he would be here to help us understand all of this. And we also have the wonderful, wonderful Mr. Roshan Singh. So Mr. Roshan Singh is a functional nutritionist, a functional health coach. He has several certifications from the international certification authorities. He has been working in specifically kidney conditions for a long time, having derived results not just for his immediate family, but for a large number of patients at large as well. So from a gut kidney axis perspective, we are going to learn today a lot of things from Mr. Roshan as well. So let me welcome both of these gentlemen. All right. So Dr. Sandeep, thank you for joining us. Namaskar. So Dr. Sandeep, सबसे पहले आपसे सवाल मैं पूछना चाहूँगा. So when we are talking about the first thing that comes to anybody's mind is the mainstream narrative, and that narrative is you have to go for dialysis. Kidney, you cannot do much. There would be a number of different conditions, but you cannot help. You can just manage by symptomatically treating the patient. And there is a lot of burden in many, many ways on the patient itself. But you have taken a great interest in understanding how gut kidney axis works. And being a consulting nephrologist yourself, being aligned with this mainstream narrative and having practiced in a similar manner for many years, how do you see gut kidney axis? What role does it play? And do you find any scientific evidence behind this alternative narrative?
First of all, thank you very much. And am I audible properly?
Yes, you are, sir. Please go ahead.
Okay. Let me tell you, first disclaimer that chronic kidney disease by definition is not reversible. It is not a reversible condition. All that as a practitioner, whether it is an allopathic practitioner or a functional integrated medicine practitioner, all that what we can do is only postpone the patient from going on to end stage kidney disease. Not only that, what we can do is we can decrease the symptoms of a patient of chronic kidney disease. To come back to your question, as a allopathic practitioner, what role we have, what are my interests in this field? See, this gut kidney axis is not an unknown fact for the nephrology community as well. Even we have been using pre-probiotics for the treatment of kidney diseases since long time. But of late, the evidence has been mounting. Even nephrology journals like Journal of American Society of Nephrology, JASN, Kidney International, these are very well-known journals. Even they have a lot of articles on gut kidney axis, which I have taken interest in trying to explore myself in my patient. For the audience who has joined, a simple thing to understand what is gut kidney axis is that our body is made up of a lot of genes. Hopefully, people know what are genes. Genes are the ones which secrete proteins. Let me tell you, our body per se is made up of around 20 to 25,000 genes. These are the genes which secrete proteins, which help us in the maintenance of our body, which help us in the various structural functions of the body, various enzymes, various hormones, etc., etc. But our body also has a lot of microbes inside us, more than 70% of them residing in our gut. Gut in the sense starting from mouth onwards to the esophagus, to the stomach, to the intestines, to the colon, and most of them in the colon. Our body is entirely made up of a lot of microorganisms. These microorganisms also have got genes. Let me tell you, 3 million genes are present from these microbes. So our body, which our own genes are 20 to 25,000, whereas these microbes have 3 million genes. So what we can understand, this particular fact, which when I read through in our nephrology textbooks, in our allopathic textbooks, in our medical textbooks, I wondered what is there has to be a connection. That is the reason I started exploring more, and I have been using these pre and probiotics for my patients. But unfortunately, because of the cost, and I being practicing in a place with very low resources, I was unable to use them on a regular basis in majority of my patients. But when I found out other alternative modalities like preparation in the form of curds, how do we culture them, how do we increase the numbers, I started using in some of my patients. Difficult to accept for the patients also initially. Okay. तो इनिशियली क्या होता है, तो ये माइक्रो ऑर्गेनिजम्स जो रहते हैं हमारे बॉडी में, तो दीज हैव इनका भी जीन्स जो रहते हैं. सो माय हिंदी इज नॉट वेरी वेरी ग्रेट, बट आई ट्राई टू एक्सप्लेन इन हिंदी एज वेल. तो जो माइक्रो ऑर्गेनिजम्स, जो बैक्टीरिया रहते हैं हमारे बॉडी में, उनके जीन्स से भी हमारे बॉडी को इट ट्राइज टू कंट्रोल. दोस जीन्स आल्सो कंट्रोल आवर बॉडी. सो हमारे बॉडी के अंदर जो गुड बैक्टीरिया रहते हैं और कुछ बैड बैक्टीरिया रहते हैं, इन दोनों में जो बैलेंस मेंटेन रखना है उसको गट, जो बैलेंस अगर मेंटेन नहीं होता है तब उनको गट डिस्बायोसिस बोलते हैं. तो हमारे पेशेंट्स, जैसे कि किडनी पेशेंट्स में जो होता है कि ये जो बैड बैक्टीरिया, सिंपल लैंग्वेज में बताऊं तो बैड बैक्टीरिया का नंबर बढ़ जाता है, तो इससे सारे सिम्टम्स स्टार्ट होते हैं. दैट इज व्हाई हम क्या करते हैं, गुड बैक्टीरिया को अंदर डालते हैं. जो अच्छे बैक्टीरिया रहते हैं, जो आर वेरी नेसेसरी फॉर अस, हमारे बॉडी फंक्शनिंग के लिए जो अच्छे बैक्टीरिया का नंबर रहता है, उनका नंबर बढ़ाने की हम कोशिश करते हैं. उससे हम सिम्टम्स कम करते हैं. तो अलोंग विथ आवर रूटीन मैनेजमेंट, अगर हम इसको भी अपना लें, वी improve, integrate this in our practice. That is what we call it as integrative medicine. Nutrition and this use of pre-probiotics and all this stuff, if we introduce in our practice, it has brought a lot of change in our patients. As I reiterate again and again, chronic kidney disease is something which is not reversible. We are not trying here to reverse the condition, but we are trying to slow the process of progress of kidney disease. Kidney disease फास्ट बढ़ने से हम स्लो कर सकते हैं, हम स्टॉप नहीं कर सकते हैं, रिवर्स भी नहीं कर सकते, हमको स्लो कर सकते हैं बाय स्लोइंग. एंड ऑल्सो पेशेंट के सिम्टम्स हम इंप्रूव कर सकते हैं. वी कैन इंप्रूव द सिम्टम्स ऑफ द पेशेंट बिकॉज ऑफ अनवांटेड मटेरियल जो हमारे बॉडी में इंक्रीज हो जाता है, जो बढ़ जाता है, अनवांटेड टॉक्सिन्स जो बढ़ जाते हैं, जो जिसको यूरेमिक टॉक्सिन्स कहते हैं, उनको कम करने से सिम्टम्स कम हो जाते हैं. So this is how I got interested in this topic, right, to explore with my patients, and I've been finding good results with my patients as well. But
Awesome.
unfortunately, initially, because of the cost, I was not able to help most of my patients. Of course, cost is also an important factor. But when we look into the cost of the patient in general, in future, overall medicine cost, if we look at the future, the cost will come down. The cost burden will come down. So that is how myself and Roshan collaborated, and we have been trying to help the patients with the help of.
Awesome, sir. So let's take this a little deeper. So, as I could understand from what you said, at the end of the day, when we are talking about managing all of these conditions which are deeply chronic and it requires multitudes of therapies and treatment strategies in general, from a mainstream perspective, eventually cost burden तो वैसे भी रहना है, headache भी बहुत सारा रहना है पूरी फैमिली का. But when we start looking at some of these integrative methods, तो हम बहुत सारे सिम्टम्स को मैनेज करने के बेहतर तरीके पा पाते हैं, थोड़ा लोड डिस्ट्रीब्यूट कर पाते हैं किडनी का, चीजों को कंट्रोल में बेहतर ला पाते हैं, तो इवेंचुअली द ओवरऑल कॉस्ट ऑफ मैनेजमेंट ऑफ दिस कंडीशन आल्सो रिड्यूसेस ट्रेमेंडसली. Now, one thing I like to pick up from toxic burden, which you were mentioning in one of your statements. So, kidney, as we all know, kidney का बहुत सारे role हैं, significant role in many ways and so on. But one of the important roles is definitely getting the body relief of the toxic burden. Now, when we are talking about, and this is something you highlighted when you spoke about gut kidney axis as well. So, I would like to welcome Mr. Roshan Singh as well. तो रोशन सर, मैं आपसे ये एक सवाल पूछना चाहूंगा, if you can add some words and details onto this. When we talking about toxic burden and when we start introducing this gut kidney axis, what in the world for a person who does not understand this very well, क्योंकि जब भी एक कॉमन इंसान को गट माइक्रोबायोम या डाइजेस्टिव सिस्टम की बात करी जाती है तो सादी भाषा में प्रीबायोटिक प्रोबायोटिक आ जाते हैं. But
Yes.
I'm sure it is much deeper than this. And when specifically we are talking about CKD patients, what do you exactly mean by this?
So namaste everyone. Good evening to everyone. So going in detail, जो kidney gut axis है और जो toxic burden जो kidney पे है. So kidney, any food what we eat and which cannot be broken down completely because of some digestion related issues or any protein basically, so they can be converted into some kind of urea or uremic load what we call. And this uremic load, the kidney job है कि उसको filter करने का. So in case if the kidney is not functioning well, then this kind of uremic load can accumulate in the body. And when the accumulation goes more higher, then the patient can have a lot of symptoms, जैसे nausea हो गया, they can have water retention, they can have, it can also cause other underlying conditions. So how do the gut microbiome can play a role to manage this symptom? This is one of the important thing in kidney disease. So apart from that, I'll also talk about what other additional benefit the probiotic can do in, especially with the CKD patients. So urea का जो uremic loads है, it actually the bacteria, there are certain microorganism which Dr. Sandeep mentioned that we ferment through the yogurt, and a person can consume that. And then the fermentation is special because we are boosting the microbial count. जो counts जो bacteria के हैं, it is like somewhere around 200 billion, 400 billion, half cup of the yogurt. तो उसके वजह से क्या होता है, the bacteria will eat this uremic load. जो यूरिया और बन और जो पैरामीटर्स जो किडनी के आपको you will see very high in kidney compromised case. So this bacteria job is to clean that, so the gut pathways. So this is one of the job of reducing the toxic load, and also the breakdown of the food it can help. So it can reduce the overall inflammation. Apart from that, the other important thing what we see in CKD is to also support immune system, a better immune system, because immune system is all reside in our gut area. So a better immune system to manage overall health. So अगर a toxic load कम हुआ तो then kidney can get a chance to extend its function and it will not burden the kidney.
Great. So, for the lay audience, what I think probably I understood as a lay person, not being a specialist in this field, is that when we are looking at digestive system and a gut microbiome axis completely in conjunction with kidney, तो काफी सारा जो टॉक्सिक बर्डन को रिड्यूस करने का किडनी का काम है वो डिस्ट्रीब्यूट हो जाता है. If we are looking at strengthening our digestive system specifically, if we are able to maybe understand the patient in very specific manners, because there is something which is very very relevant, especially when it comes to microbiome on these small little organs, something called bio individuality. हर बंदा बहुत ज्यादा फर्क है और इंडिविजुअली उस पर काम करने की जरूरत है, बट उस तरह से अगर करते हैं तो डेफिनेटली हम रिजल्ट्स पा सकते हैं. एक और इम्पोर्टेंट चीज मैं टच करना चाहूंगा रोशन सर आपके साथ में, सो विच इज अबाउट kidney also plays an extensive role in balancing electrolytes, which again have a forbearing effect in many of biological processes, as well as producing, enhancing, distributing several micronutrients. So this equation with a compromised kidney is any which way hampered. Can we do something with the rest of the body or digestive system in specific, so that we can enable the kidney in a better way?
So one thing, what the gut microbiome, and along with that also we use fiber or the prebiotics. So suppose someone has a high potassium level, so or a phosphorus level because of the low kidney functions. So कुछ जो fibers हैं, they can bind with the potassium and reduce the overload of the potassium in case. So whatever the minerals, because the excess of imbalance of minerals can again spikes the blood circulation, and cardiovascular issues can happen. So it's very important that these minerals are in balanced state and not in excess as per the clinical range. Apart from that, the microbiome also helps to assimilation of the food, so to break down and convert into essential amino acid. So essential amino acid like protein, it is from protein, and as we know, protein cannot be taken heavily for the kidney compromised case. So they actually have a lot of fatigue and a lot of symptoms like tiredness, nausea, and things like that. तो उस केस में हमें वह प्रोटीन लेवल बॉडी में through breakdown of the food and some support, external support, तो उससे हम increase करते हैं. And some of the case, like some kidney function also do some of the hormone production, like for example erythropoietin is a hormone which helps for to produce more of the hemoglobin and RBC. So sometimes it can also be like anemia and other kind of symptoms in CKD.
Right, sir. So there is one very important question with one of the participants. What is the hope for dialysis patients? Because this is one direction. So I'll also want to request to people who have joined us live. So any questions that you are having, or anybody you think who is suffering from CKD or anything similar in terms of health issues, so ask them to join this live stream, and they have an opportunity to ask from the experts directly. So your response to both Dr. Sandeep and Mr. Roshan, if you have a response to people who are suffering from or have to undergo dialysis.
I'll answer this. Basically, dialysis is done when patients reach stage 5 of chronic kidney disease and they become symptomatic. Not every patient of stage 5 may need dialysis unless if the patient has got good urine output. If patients do not have symptoms, even if they are in stage 5, sometimes we may not do dialysis, and there are various studies to say that starting dialysis very early and starting dialysis late when patients become symptomatic, there is not much difference in the outcomes. Good number of studies have shown that early versus late start of dialysis. So here with the treatment, if somebody has got good urine output, we may decrease the symptoms of the patient. As I said, we may not be able to stop or halt the kidney disease, but we may be able to decrease the symptoms of the patient so that patient may not require dialysis. Normally we do dialysis because patients have got symptoms. Symptoms in the sense that they have got vomiting, they have got nausea, unable to eat, they are listless, they are not able to do any work properly. All these are symptoms. They have got breathlessness because of acidosis. So we start dialysis in such patients. especially if somebody has got good urine output, मतलब जिसके बॉडी में अगर पानी जमा नहीं हो रहा है, लंग्स में पानी जमा नहीं हो रहा है, उनको ब्रेथलेसनेस नहीं है, तो हम we can postpone dialysis in such patients by integrative approach, by decrease the symptoms with the help of pre and probiotics and other supplementary medications, amino acids, as I said, keto add amino acids, and then other like soda bicarbonate as supplement, along with integrative approach with the help of like functional medicine experts, we can decrease the symptoms so that we can postpone their dialysis. I myself have a couple of examples which I've shared with Roshan as well. Somebody who was on dialysis for more than 6 months but had a good urine output, his creatinine has stabilized at around 4 or 5 and his symptoms have come down. So he has been off dialysis since more than a year. So these things we can, of course, financial burden will come down not being on dialysis, apart from other burdens as we know about patients on kidney kidney patients on dialysis. But again, there are certain ifs and buts. There are certain conditions applied here. If patients have got good urine output, I mean that we need to assess individually. Maybe if Roshan can add further points.
Yes, so considering both the case, like someone, whatever the stage of the kidney disease, we have certain supplements and probiotic and prebiotic combinations to reduce even if some of the symptoms what they have, because kidney is a secondary disease and they might have some other coexisting disease or multifactorial disease like blood pressure or diabetes or autoimmune or other conditions. So we have to manage overall the whole body and system and not just focus on the kidney. So here whatever stage the patients is, we can definitely make them symptom free and try to extend the dialysis requirement. And then the query to the person who is already on dialysis, what we can do about it. So we can definitely work again. The approach will be a little bit different because the person is going on dialysis. So the person might need some other additional nutrient support. But as a core principle of probiotics, so probiotics will be the same, but it is also to build the more muscle mass and improve the protein efficiency and the bone density, because many dialysis patient also goes to the bone disorder. So इस case में so overall probiotics can be helpful in every stage, but prebiotics we have to decide what stage prebiotics and what dose, because of the water intake is limited. So because of that, the prebiotic has to be customized.
Absolutely, sir. So, from that perspective, there is one obvious question which comes to my mind. When we start talking about prebiotic or probiotic, एक common Indian psyche है, especially हम सभी लोगों की, हम अच्छा खासा लगभग 150 करोड़ लोग हैं, लेकिन जब हम प्रीबायोटिक और प्रोबायोटिक की बात करते हैं या फिर सप्लीमेंट्स की भी बात करते हैं, so the common understanding is off the shelf there are certain options which are available basically. And every prebiotic is a prebiotic. So prebiotic means prebiotic. Anything could be taken, and same with probiotic. And unfortunately, same is the case with many of the supplements which are out there in the market. So, what caution that people should take? How they would be able to analyze which is the right choices for them? Are there some tests which enable us or you as a functional medicine expert to understand the mechanism of these pathways and work on those particular aspects in a better manner?
Yes, definitely. So coming back to the choice of probiotics, so probiotic is basically chosen based on conditions. Agar CKD ke saath there is other condition like autoimmune, so we have to choose some bacteria which can decrease the autoimmune bacteria in the body. And if there is a diabetes, then we have to add certain bacteria which can decrease the sugar load in the blood. Or if there is a blood pressure issues, so we add a probiotic which can increase the nitric oxide, which can help in the circulation of the blood and lower the blood pressure. So probiotics, we choose a specific microbe, and we have to be careful that we don't choose anything which can cause a lot of reactions or histamine overload. So histamine is basically a allergy reactions. So we have to choose something, because a lot of kidney patients, they have itching in the body. So we have to choose a certain probiotic which is antihistamine in nature, जिसका काम होगा हिस्टामिन को कम करना बॉडी में, or not to increase the. So there are certain, we have a lot of blogs and informations about that. Apart from that, the prebiotic, the most effective prebiotic in the journals and the research, and even we have used in our practice, is acacia fiber. So acacia fiber, ideally in the stage 1 to 3, we use something like 1 gram per kg of the weight, and then that's something really helps. So blood markers may burn urea level, chloride level, CRP and ESR level. These all things you'll see that they will be in a good range, like functional range, optimal range. So they will reduce if they are very high, and then you see that whether you have to more increase the prebiotic, or you have to decrease based on this blood markers.
So another question, couple of questions from the audience who are listening to us, viewing us. So would this approach be useful in increasing the urine output in any manner? And looking at EGFR numbers, would it help us in improving them as well?
Yes, from functional side, I'll comment, and then Dr. Sandeep can comment as well. So someone coming at the creatinine level 4 or 5 or even anything above 3, one thing we see, we can probably decrease a little bit and make that creatinine and GFR stable there, as long as they are monitoring the other parameters and monitoring the symptoms. So we do see, like, for a year or more than a year also, the values is quite stable until they catch another infection or there is some issues, then this thing can change. Well, overall, with good diet, diet means like alkaline diet, something you're controlling the protein level, the potassium, the electrolyte levels. So that all can really help. Anti-inflammatory food, I mean, and then maintaining the good albumin level in the blood. So albumin should be above 4 to decrease. So albumin has a strong connection with the GFR and the creatinine level. As long as the albumin level stays higher, like above 4, 4.2, and other markers are good, your GFR and the creatinine level will be very stable. And then the symptoms, of course, we are managing the overall symptoms. So I will pass to Dr. Sandeep to share his comments.
As regards you asked the question regarding whether urine output can be increased or not, शायद यही था ना question आपका? So
yes.
In the kidney disease, there are different varieties. There is something called glomerulonephritis. There is something called tubular necrosis. There is something called interstitial nephritis. Glomerulonephritis is something where urine output will come down. So glomerulonephritis में जो kidney का main filter portion रहता है, that gets damaged. If that happens, then urine output will not improve, because that is where the blood passes and filtration of water happens, filtration of blood happens, so water will come out from there. So ideally, patients with glomerular disease, we may not be able to do much allopathically, and I understand logically it cannot be done anything, but only thing what we can do is, generally patients with glomerular diseases are more symptomatic. So since they are more symptomatic, supportive therapy will help to decrease their symptoms. May not be able to increase their urine output, but decrease the symptoms. But again, here the question is whether the patient has got CKD or acute kidney injury. That is very important. We need to differentiate the cause of decreased urine output. Urine output क्यों कम है, वो हमें ढूंढना है. If we are able to treat any correctable causes, that is very important. We have to look for the correctable causes of decreased urine output, what we call oliguria or anuria. If at all there is anything correctable from our end, that we can help. And if there is absolutely no correctable factors to improve the urine output, if it is chronic glomerulonephritis, then of course we cannot do much. But what we can do is, these patients' symptoms will be very high. We can decrease the symptoms and improve their quality of life. Even having a good quality of life is also important for any patient, not only a patient, for any healthy human being. Having a good quality of life is very important. We can help improve their quality of life.
So the next question I would like to ask both of you together is about, we have talked a lot about different symptoms. So when we talk about different symptoms, these could emanate from a lot of comorbidities, which typically are there with a CKD patient. Could be, let's say, BP or a cardiovascular condition, and with many others, there could be chronic infections and inflammations. In some cases, maybe liver is also getting compromised. So, can you elaborate on when we talk about symptoms, what do we actually mean? And specifically talking, Ms. Roshan, to you, when we are talking about gut kidney axis, so these symptoms, what is the extent of management of these symptoms or even reversal of these symptoms, which is possible, and how do we enable it?
Okay, I will talk about that, and then Dr. Sandeep can add more on the overall the morbidities and other things. So, symptom like someone coming with the CKD and having other disease dynamics there, like it could be diabetes or cardiovascular or autoimmune, any of the three, or maybe all together. Sometimes they have rheumatoid arthritis and other conditions also. So we try to first, whatever the symptom the person has, the first thing what we see is the constipation, because the drinking the water is intake is limited, and because of that the constipation can build up. So here the probiotics can really help. There are certain microbes they can really help in the constipation. So to have a better stool, and probably it will decrease the symptom, because if the food is not eliminated from the body, then this all lead to the high urea load or uremic load, because it feeds the microbes, the bad microbes. So bad microbes will produce more toxins, and then there will be overall burden. So this is something very important to address any kind of digestive disorder, whether it's a constipation, whether it's a diarrhea, whether it's a nausea, whether it's acid reflux, or any gas bloating pain kind of scenarios. Second thing what we see is like diabetes case, we want them to stabilize their blood sugar and maybe slowly wean off their medications. So it is very much possible. We have seen many patients where giving certain probiotics to decrease the blood sugar and boosting certain microbes, which is something called as Akkermansia. Akkermansia is very much, there are a lot of research you can find. It can decrease the HbA1c and the sugar level, just boosting the Akkermansia. So we try to boost the Akkermansia through the probiotic and the fiber which the Akkermansia loves to eat. And then suppose in the cardiovascular case, we try to add a microbes which is boosting the nitric oxide. So that will help in the circulation of the blood. And similarly for arthritis or any other autoimmune disease, we add microbes to reduce the inflammation in the body, which is something like raised CRP, ESR, or other inflammatory markers. We try to decrease those numbers so the symptoms of pain and other issues can go down. Similarly, there could be a patient who has a lot of water retention in the body, swelling and etc. So which diet also plays a big role in reduction of those excess of water, because it could be because of electrolyte imbalance and mineral imbalance also. Or it could be because of the cardiovascular, where the blood pressure is not normalized. So all these things together, it really helps to bring down the burden. Also, we see like sleep, which I wanted to add. The sleep is very compromised for this patient because they have a lot of fear. They don't know what's happening next. They are fearful to be on dialysis. They have been thinking that now my life like become more monitored with the machine. So those cases, improving the sleep quality with certain probiotics, and mental health, emotional health, because there is a gut-brain axis also. So increasing those hormones and those serotonin and oxytocin boosting can help in having better sleep, better emotional health, reducing anxiety. So that can definitely help to improve the quality and also the healing process. So this is all I think wanted to add, and then Dr. Sandeep can add more on this.
Definitely. Generally, what we have seen is patients with other comorbidities, like especially diabetics or autoimmune diseases and cardiovascular disease, that is heart diseases. These are the patients generally are very symptomatic because they get recurrent infections. Their immunity is low. They get recurrent infections. So we need to build their immunity in by whatever means, whether it allopathic or integrative way. And generally, integrated medicine nutrition helps a lot in these patients. And nutritional support, as Roshan was mentioning, helps a lot in improving the immunity of these patients. Any episode of infection in such patients will again bring down their health, and they start becoming more and more symptomatic. Apart from this, as Roshan was mentioning, these patients of CKD also have a lot of psychological burden. As I have seen in my clinical practice, patients who are educated and on dialysis and patients who are uneducated on and on dialysis, there's a lot of difference, because educated patients know a lot about their disease, the outcome, they read a lot online, and they start becoming more and more depressive. So they don't do well on dialysis. Patients who are not literate, of course, there are no studies on that. Patients who are not literate, they don't know anything about their disease, they do not think about their disease. They just come to the dialysis unit, get dialysis done, and then go back. Those patients do surprisingly very well. One more what I have noticed is young patients who have a lot of life ahead, and if they they come on dialysis, their outcomes are poor. All this, what I'm trying to tell you, is psychological aspects. These patients start developing depression, and their psychological, their because of depression, they become sleepless, their health goes down, their immunity goes down. So what we can do with the integrated approach, not just by giving medications, we cannot improve. We have to improve their overall well-being. We have to take care of their psychological aspects. We have to take care of their nutritional aspects. Not just the symptoms, we have to take care of all these aspects. Only then we can bring some positive change in a patient.
Awesome. So, sir, I would like to ask a question at this point. First of all, to all the audience who are listening and viewing us, etc. अगर आप लोगों की तरफ से कोई भी सवाल है तो please add those questions in your streams. We'll pick up those questions from the chat and we'll try to ask the experts. But one thing which I would like to definitely ask you people, today, एक opportunity है, from your perspective, when we hop on to strengthening this gut-kidney axis, from an anecdotal point of view, financial, social, physical, mental, सभी तरह का burden रहता है patient पर और patient की family पर. कुछ आपके पर्सनल एक्सपीरियंस से कुछ ऐसी केस स्टडीज रही हो या कुछ ऐसे अनुभव रहे हो wherein we in both in terms of parameters in some way, both in terms of integrated health of the rest of the body, many symptoms that we are seeing, but also mainly social and psychological aspects. How is it that we could help these guys, especially when we understand when somebody is suffering from CKD, वो जॉब नहीं कर पाएगा, उसके लिए बहुत मुश्किल होगा. क्या ऐसे भी कुछ केसेस हैं जिसमें हम उसे इनेबल कर पाए कि वो एटलीस्ट पार्ट टाइम कुछ काम कर सके, बर्डन अपने ऊपर भी ले सके, या किसी और तरीके से फैमिली का सपोर्ट बन सके?
Can I take this question first, Roshan? See, as I said, patients of CKD stage 5 on dialysis need not be out of job. They can do their job. They can just come to the dialysis, get the dialysis done, and go back if they are on dialysis. If they are not on dialysis, then that is also okay. If they are healthy, they are well maintained, their nutrition is good, their overall immunity is good, they can do their job normally without any hindrance or hurdles. But only what they have to understand is that what is their stage of disease and what are their parameters. They have to keep checking their parameters regularly, and of course take an integrative approach to manage their symptoms and manage their other overall aspects. As you are mentioning regarding any specific examples, what you said, of course, Roshan may be having more examples about this. But a couple of my patients whom I have seen, as I was just mentioning, one of the patient, pretty old, about 70 years, he was on dialysis for more than a year, but he had good urine output. He was coming to us for dialysis only for the fact that he was very symptomatic. He was not able to eat properly. But by using these, now, as I said, he's off dialysis, his creatinine is between 4 and 5, and he is able to maintain his routine activities without the necessity of dialysis. So, of course, initial financial burden because of pre and probiotics was high, but definitely since he is off dialysis, he's asymptomatic, he's living a better quality of life. We cannot measure everything in terms of rupees or money or whatever. So, only in terms of currency, but we have to look in terms of his overall quality of life. Of course, getting off dialysis also decreases the financial burden as well. So like this, there are a couple of examples who are not yet on dialysis, but they were symptomatic. Because of their symptoms, we started using this integrative approach, and then their symptoms have gone down, and they are able to do their routine activities. Especially, there is a patient of mine who is around 30 years old who has been on dialysis since the party past 8 years. He was able to do his routine activities. He was able to do his job. He is a salesman by job. He does his routine activities, but at the end of the day, he was feeling very weak. He was mentally depressed because he felt that he is going to die any moment. But by using these approaches, his quality of life has improved. He's still the same physically, he's on dialysis still, but he's mentally he's better. His hemoglobin has improved. He's still healthy or whatever, energetic at the end of the day. So this is what has made difference in his life. So all these small changes also, as I said, we cannot measure everything in terms of financially. Of course, psychometric analysis has to be done. Psychologically, how they are feeling better, their overall health has improved. Health, again, I'm going a little off track here. Health is not just being away from illness, it is a complete physical, mental, and psychological and social well-being. It is a WHO definition. Health is nothing but physical, mental, psychological, and social well-being. Okay, so here we are not only looking in terms of physical well-being, strength, energy, creatinine numbers. These are not the not everything. This is not health. You have to also have a good psychological well-being. You should also have a good social well-being. Social well-being in the sense able to do their activities, able to do their jobs, their routine activities, morning walk, going to their friends, talking to their friends, having a good social life. This is also health. So this in this way, a couple of my patients' life has improved. So this is what I can say from my end. And if Roshan can add something.
Yes. So we had patients like from different age groups. Some are young and some are in the age of 40s and 50s and 60s and even 80s. So they all is like bio-individual approach and what creatinine level they are and what are the other underlying conditions. This all will matters in terms of improvement. And of course, there I feel even the patient who comes at creatinine level 4 or 5, and when we improve their symptom, they are much more active than a non-kidney disease patients. So there's a lot of and someone who comes early, like at the creatinine level 1.3, 1.5, and they know they have a compromised kidney function. In some cases, they might have only single kidney. So in those cases, or we with the use of supplements or the probiotics or the things are not that extensive list, not like exhaustive list. It may be minimal approach, but they can really maintain that good quality life. Like young children, also we see a lot of like CKD stage where they can't go out and play. So, but we have to build that strength and their overall health so that they can do other activities like a normal child. So again, we have seen a lot of improvement. Even someone comes at creatinine level 6 or 7, we have seen that we are able to stabilize for many months. And again, depends on, as Dr. Sandeep mentioned, if there is any kind of infection or anything which can lead to antibiotic usage or any kind of drugs which can overload the kidney. Many cases we see even steroids. Some of the patients are on steroids, like they are having autoimmune conditions. So steroid can be damaging to kidney further. So we have to slowly descale those medications and then work as integratively. So yes, there are a lot of possibilities, and again, I want to mention same as Dr. Sandeep. We are improving the overall quality of life. We are making them symptom free. We are preserving the kidney, whatever the creatinine level and whatever the residual kidney functions are left over. We are trying to maintain that as much possible, with all this approach. And again, we are not trying to burden people with this different approach. We have to again go with the bio-individual approach, what they really required and what are the symptoms, what are the blood markers. So it's like again customized based.
Awesome. So sounds like an array of hope and pretty much a bouquet of possibilities for people who are suffering from CKD and related conditions and so on. So thank you very much, Mr. Sandeep, Dr. Sandeep, and Mr. Roshan for joining us. If there are more questions from people, we'd love to have them. But by and large, I'm sure you found this awareness session interesting to know more about the work that Mr. Roshan does, Dr. Sandeep does, how to get connected with them, take their services, or understand about their services and their methods. The links are there in the channels that you have joined us from. You can join the WhatsApp group, or you can connect with the counselors, and they would be able to guide you upon and help you get connected. So thank you very much for joining in. Um, and we would love to, have deeper interactions individually with you as best as possible at your own convenience. Thank you. Thank you so much.
Thank you, everyone.
Namaste.